health and a little wealth and a lot of love.
So we talk about kidney and liver function. I would imagine that's the risks, but are there other risks?
Well, the risks of polypharmacy really are medication toxicity. So if you think about medications, especially the ones that can be sedating, so medications that we use for anxiety, for mood disorders that can be sedating.
And you are on anxiety I'm sure you don't want your business out there, but let's be real. Like, you're on anxiety medicine. So what does that do for you as a risk?
And not all of them. So, medications like SSRIs or SNRIs, which are classic first-line medications that we use to treat anxiety and depression right now in mainstream traditional medicine, they're not necessarily sedating. Some of them certainly can be, but the ones that are more concerning are going to be your benzodiazepines, like your Xanax and your Valiums, also your mood stabilizers that we use more for bipolar disorder or schizophrenia or schizoaffective disorder. Even when we have dementia, patients with dementia who have more psychosis, so they have hallucinations and more agitation, and sometimes the medications that are used to treat those potentially will treat those symptoms, but they also can cause some sedating, some cognitive effects. And when you think about the people that we're treating, so obviously dementia is something that we typically see in older patients, and these are the patients that are at higher risk of not being able to metabolize those medications, then those are the people that we primarily use those medications and are at highest risk of the side effects.
Got it. That makes sense.
With a little health and a little wealth and a lot of love. That's the life that we live. Suits and scrubs.